are neurologists so slow to say, this is what you do? And what they do, they always say, well, what's good for your heart is good for your brain. But surely there's more to that, because the brain is much more complex.
We've known about pumps for thousands of years, like the ancient Greeks, knew about pumps. And so it's easy, not really, but it's easy to understand it and know how to deal with it. The brain may be closer to a computer. We've only known about computers for the last 100 years or so, maybe less. And that is a much more complex organ in many ways. And so we have, I think, the neurological field, even the stroke field, is about 20 years or more behind the cardiologists in terms of understanding what to do for people to prevent and treat heart disease. So now we're catching up, and just within the field of stroke, it's been pretty amazing to see how quickly things have changed over the last 5 years or so in terms of treatments that we have available for stroke. We used to joke in residency that neurology was diagnose and adios. You could recognize it. Neurologists don't treat disease; they admire disease. It was always very interesting, but there was nothing you could do about it. But that's really changed now. You can actually intervene and reverse a stroke, and people can leave the hospital in great shape. We're catching up, and now we're recommending a lot of those same treatments and suggestions for how people can maintain cardiovascular health and brain health.
There was a recent article in Stroke written by the American Heart Association and the American Stroke Association showing 60% of all stroke survivors develop cognitive impairment within a year, and then a third develop dementia within 5 years.
That idea that you can have a stroke, so a stroke is an injury to the brain that's caused by a problem with a blood vessel, right? So it can be a blockage in a blood vessel and a part of the brain doesn't get enough oxygen and it dies, or it could be bleeding into the brain that damages the tissue directly. Traditionally, we thought people would have a stroke, they would have some kind of deficit, like paralysis on one side or aphasia, difficulty speaking, for example, and then you would gradually recover from that. And you might not reach the state you were in before. People obviously are left with some people have long-standing deficits after a stroke, but we kind of assumed you would eventually reach a new normal and stay at that level. And what we've discovered in the last few years is that after people recover, they may then decline gradually after that. Perhaps it's neurodegeneration. It may accelerate some of these degenerative processes like Alzheimer's. This is that crossing the blood-brain barrier. Having a stroke also leads to an acceleration of the degenerative process. Why does that happen? Not entirely clear. It may be due to, we think, neuroinflammation. So when there's damage to the brain, like a stroke, there's inflammation that occurs, and that doesn't always go away. It's not just like getting a bruise. It's more like you're left with a bit of a scar that may continue to fester at a very low level for a long time.
So I hope that we can change the course.
Things that we can do, that we know about already, would be to control cardiovascular risk factors. So, addressing heart health. So at the American Heart Association, we think of this in terms of what we call life's essential 8. They are 4 behaviors and 4 factors or numbers that you should know. So just start with the numbers. People should know their blood pressure, their glucose, their cholesterol, and their weight or body mass index. And you want to keep those at the right target levels. And if you want to look up these levels, you can find that online, Life's Essential 8 or or at heart.org. Then the behaviors are getting physical activity. We recommend 150 minutes a week of moderate physical activity. Not smoking, of course. Eating a healthy diet like the Mediterranean diet or what's called the DASH diet, dietary approaches to stop hypertension. And I'm forgetting one of them, sleep. So thank you. So yes, and that's what's so exciting. So we used to call it Life Simple 7, and now we've added sleep, so now it's Life's Essential 8. and which is very exciting to me because that is really the first more brain, we think of sleep as really being a brain phenomenon or function, and so that's the 8th one, getting at least 7 to 9 hours of sleep a night would be meeting that criterion. So those 8 elements help to maintain heart, cardiovascular, and brain function as well.